I grew up in the 70s, and so back then everybody wanted to be a Dallas Cowboy cheerleader. I'm not even from here, but that was my first career choice. And then after that, I decided I wanted to be a doctor. At first I wanted to be a neonatologist and help babies once they were born, but what I realized very quickly was I was more interested in the why and how they were born than what happened after they were born. And so I figured out that I wanted to be an OB, sometime in elementary school, I think. So it's all I've really ever wanted to be. I have been married to my husband for 28 years, and we have 2 grown children, a son who's 23 and a daughter who's 22. So my life has been very busy with work and with raising my children. I was very involved with both of my kids' activities, Girl Scouts and Boy Scouts and booster clubs and engineering club and basketball and volleyball and all of those things through all the years of school. I moved to Texas 24 years ago, joined this practice and helped build and grow the practice with Dr. Banks. When we moved to Texas, I was pregnant with my son, and so Dr. Banks delivered my son James in December of 2000, and then Dr. Banks and I both wanted another baby, but we didn't really coordinate very well on the timing of it, and so we found ourselves pregnant and due 4 weeks apart when it was just the 2 of us. So it was a little bit hectic back then, and so I delivered a couple weeks early. We thought, oh man, we dodged a bullet. Everything's gonna be fine. There'll be plenty of time between our children because I was a couple weeks early. Well, she had to deliver 4 weeks early, and that meant that our children were born 13 days and 1 minute apart. It was a little nuts back then, but we got through it, and I just brought my daughter to work with me every day. And for those first couple of weeks that I was back from maternity leave, I just held her when I went into rooms and saw patients. We joke about times when we would do surgery and have to kind of wedge our bellies next to each other to be able to get close enough to the patient, and our babies would move to each other. So we had a lot of fun pregnant together. A day in my life there's actually quite a lot of variation. I have days where I come and I'm in the office all day, seeing patients, doing procedures, doing well woman exams, problem visits. We have days that we're in the hospital all day, so I might be delivering babies, doing surgeries, different gynecologic surgeries, answering phone calls, kind of solving problems as they come up throughout the day. Some days I do both. It varies quite a bit, which is one of the appeals of OBGYN, is that you never know what's going to happen. People ask me, well, how many babies are you going to deliver today? And I say, I have no idea. I have no idea what to expect. The days are very unpredictable, but it's always exciting. I look back at pregnancy so fondly, personally, and I think it's such a privilege to be pregnant, and there's so many people that never get to experience it. And so I often say to my patients, just remember this feeling and hold on to it, because being a parent is the hardest thing I've ever done, and there are days when it's so challenging. But if you can sit back and remember how completely special it was to feel your baby move inside of you, and to know that you have this bond that can never be broken with your baby, and how lucky you are to get to do that, then it makes everything else small in comparison to that. And so I tell people to just let it sink in and remember how unique this time of your life is, this stage of your life, how special it is, how beautiful it is, and how truly lucky you are to get to know what that feels like.